I'm pleased to share with you a whole family approach to hepatitis B virus prevention Thailand experience. In this topic, we have two presenters. I will talk about hepatitis B virus elimination mother-to-child transmission in Thailand, experience on couples HIV testing and counseling, and opportunity to integrate family approach to HBV prevention. Dr. Surasit will present examples from the field. I have no conflict of interest to report. Thailand is the first country in Asia to achieve elimination of mother-to-child transmission of HIV and syphilis in 2016. In 2020, the country achieved hepatitis B virus control target ahead of time by having less than 1% prevalence of hepatitis B surface antigen positive in children less than 5 years. In 2021, Thailand was selected by World Health Organization to be part of the country pilots for viral hepatitis elimination. Thailand has provided a high-quality maternal child health program for more than 50 years. More than 98% of pregnant women had at least one antenatal care visit and delivered in healthcare facilities. The Thai government provides most of the budget for PMTC of HIV, syphilis, and hepatitis B virus. This table shows the national benefit package for PMTCT of HIV, syphilis, and hepatitis B virus for pregnant women and their family. I would like to highlight HIV and hepatitis B benefit package. For HIV, the benefit package includes provision of couples HIV testing and counseling. HIV-infected pregnant women and positive partners of pregnant women have access to antiretroviral treatment. Babies born to HIV-positive mothers receive free replacement feeding and early infant diagnosis. HIV zero-discordant couples have access to PrEP service. For hepatitis B, the benefit package covers hepatitis B surface antigen screening in pregnant women and hepatitis B vaccine to all babies born in Thailand. The Thai government launched the National Couples HIV Testing and Counseling Policy in antenatal care settings in fiscal year 2011. CHTC is defined as pregnant women and their partners receiving HIV testing and counseling services together. This slide shows the uptake of couple HIV testing and counseling, partner testing, and voluntary counseling and testing in Thailand. The dark green color represents the uptake of couples HIV testing and counseling, which increased from 20% in fiscal year 2012 to 40% in fiscal year 2020. In fiscal year 2020, almost 3,000 of HIV positive women and 800 HIV positive men identified as a result of couples HIV testing and counseling, partner testing, and voluntary counseling and testing. Approximately 55% of partners of pregnant women were also aware of their HIV status. As a result of this effort, we identify HIV concordant and zero-discordant couples and link their partners to treatment and prevention services. High engagement of partners of pregnant women provides great opportunity to integrate syphilis and hepatitis B testing as a family approach to prevent syphilis and hepatitis B virus transmission in the family. This slide shows the milestone of hepatitis B virus policy and program. Thailand started hepatitis B virus screening in pregnant women in 1988 with HBV testing coverage greater than 95% in 2014. In 2018, Thai Ministry of Public Health implemented tenofovir for hepatitis B antigen positive pregnant women in pilot provinces. Since 1992, all babies born in Thailand have received hepatitis B vaccine at birth, 2 and 6 months as part of the EPI program with high vaccine coverage. Infants born to hepatitis B virus positive mothers receive an extra dose of hepatitis B virus vaccine at 1 month. HBV is not included in the package and is self-paid for some babies. As shown in the bottom part of this slide, the prevalence of hepatitis B surface antigen positive was reduced from 7% in 1988 before the EPI program to 3.5% in 2014. Prevalence of hepatitis B virus carriers among children less than 5 years old was 0.1% in 2014. Prevalence of hepatitis B virus carrier in pregnant women was less than 3% in 2020. Despite high uptake of couples HIV testing in Thailand, we found that partners of pregnant women do not routinely engage in hepatitis B virus testing process. Some chronic hepatitis mother may not be linked to care after delivery. Many babies born to hepatitis B virus positive mothers do not get serological testing after completing HBV immunization. Mothers with chronic hepatitis B virus infection have the highest risk for hepatitis B virus transmission. Hepatitis B vaccine and maternal antiviral therapy are effective tools to prevent HBV transmission in babies. About 14 to 60% of persons living in households with persons with chronic hepatitis B virus also have evidence of resolved HBV infection, and 3 to 20% have evidence of chronic infection. Therefore, a family approach for pregnant women with chronic hepatitis B virus could potentially prevent some HBV infection in the family. This diagram illustrates the family approach to prevent HBV in selected sites in Thailand that has been implemented during the past 5 years. It is based on the linkage of pregnant women with hepatitis B virus and their sexual partners and household family members at risk to testing and appropriate care. HBV transmission can be prevented by providing HBV screening, hepatitis B virus vaccine for babies, antiviral drug for mothers with high HBV viral load or hepatitis B antigen positive, and HBV for babies. Furthermore, we should offer HBV testing to sexual partners of pregnant women with HBV. We can promote hepatitis B virus prevention counseling and refer positive cases to specialists for proper management to prevent cirrhosis and liver cancer, as well as provide key messages to prevent HBV transmission in the community. Finally, we should ensure that family members with hepatitis B virus who tested negative get vaccinated. In conclusion, existing data have shown progress toward elimination of mother-to-child transmission of hepatitis B virus in Thailand. Couples counseling and antenatal care provides great opportunity to integrate HBV counseling and testing for couples and family. Persons living in households with persons with chronic hepatitis B virus, including babies, are at risk for HBV infection. A family approach promotes linkage of sexual partners and family members to testing and vaccine services. Linkage of HBV carrier postpartum women to care should also be included in routine services. In the next presentation, Dr. Surasit will share examples of family approach for hepatitis B virus prevention in Thailand. I'd like to thank the following partners for their support and contribution to elimination mother-to-child transmission of hepatitis B virus in Thailand. And thank you for your attention.